And I wanted to thank everybody for joining us. And Shiloh is our amazing Medicare individual specialist, and she's going to be hosting the meeting because she is our specialist.
That's
um,
me.
so with that, I also wanted to let you guys know that if there's some questions that we're not going to be able to answer just because of privacy reasons. So we'll talk about it at the end, but just know that if you have questions, you can reach out to us directly at any time. I mean, I hope that we've proved that we're pretty good at responding and answering the questions you guys have. So with that, I'm going to turn it to Shiloh, our amazing
Hi,
specialist.
that's me. Yeah. So I know some of you guys, I have worked intermediately with a few of you. So if you don't know me, my name is Shiloh. I'm an individual specialist here at IBC. So I do everything individual, from individual family plans to Medicare, even travel. I'm kind of all over the place when it comes to that sort of thing. So I'm going to be the one that is going to go over everything Medicare with you today. As I mentioned, it's going to be incredibly basic Medicare 101. There is a lot of moving parts to Medicare. If you guys have worked with it in the past, I'm sure you're a little bit familiar with how they all are very different and very confusing. And sometimes it feels like it's meant to be that way. So we're here to kind of clean up some of that confusion and make things a little easier. Today, I'm going to go over what exactly is Medicare, parts of Medicare, such as original Medicare, A and B, prescription coverage, which is Part D, and supplemental and advantage plans, which are Part C, and then Medigap. As I mentioned, this is going to be a lot of information, so bear with me. As Heather also mentioned, some questions we won't be able to answer just to all of the crazy legislation and the rules that are in place for Medicare to perfect the beneficiaries. But if you do think of something that's super generic, please pop it in the chat and I'd be more than happy to answer as we go along. So we'll start with the basics. What is Medicare? A lot of you know that it's for those that are 65 and over. Medicare is a federal government program that provides health care to those that are 65 and over. However, there are some that qualify for Medicare that are under the age of 65, such as those who are receiving Social Security disability insurance or have some type of end-stage disease or ALS. The Centers for Medicare and Medicaid, or CMS, is the federal agency that runs Medicare. They work very closely with Social Security, and that is essentially what Medicare is tied from. It's tied into your financial information. It's tied into Social Security. CMS is just that federal agency that's running Medicare. You'll see CMS, or Centers for Medicare and Medicaid Services, referenced quite a lot in a lot of documentation. So I always like to let people know what exactly that is, what exactly they do. There's different types of eligibility when it comes to Medicare. The most common is turning 65. And that opens up an enrollment period where you are allowed to enroll in Medicare. In some cases, you sign up or you're automatically enrolled. In some cases, you have to enroll on your own. That's something I'll go over a little bit later. Under 65, when you're receiving Social Security disability insurance, you're automatically enrolled in Medicare after 24 months. So if you've been receiving Social Security disability insurance for 2 years or 24 months, you're automatically enrolled in Medicare regardless of your age. Same thing with ALS or end-stage renal disease. You can enroll anytime after you've been diagnosed. And there are some other diseases that are included in that, but these are the most common. The second most common eligibility is retiring or leaving employer-sponsored coverage. Nowadays, and in my opinion, 65 is barely senior age. A lot of people are working over, more and more people, especially now, are working beyond the age of 65. So you don't have to enroll fully in Medicare once you turn 65 if you are still working. If you still have that employer coverage, you don't have to switch and move everything immediately upon turning 65. You can choose to stay on your employer coverage until you retire or until you leave that plan. It does open up a separate eligibility enrollment period for that time, but it is a qualifying event. To be honest, more often than not, people who are turning 65 are still working. So they remain on their insurance until they are ready to leave, or even if they're just exploring the options. It's not uncommon for me to run a comparative between their current employer-sponsored coverage and what it would look like if they were to move 100% onto Medicare. Believe it or not, it's actually a lot cheaper than it used to be and a lot better than it used to be. So more and more people are making that full transition. So during enrollment periods, each eligibility kind of has its own enrollment period to it. Your initial enrollment period is when you turn 65. You have 7 months in order to enroll in Medicare. You have 3 months prior to your birthday, the month of, and 3 months after. This is when you can enroll in Part A, Part B, Part D, supplemental, or an advantage plan. It's really, you have the 7-month period in order to get all of your Medicare into place. Certain parts of Medicare are automatically. So for example, if you are eligible for automatic Part A, it just automatically goes, you don't have to do anything during this time. But when it comes down to Medicare, and I think that's one point that I drive home very frequently to my clients, is that it's incredibly individualized. What works for one person doesn't work for the other person. What one person has for an eligibility or an enrollment period might be something completely different for someone else in someone else's case. So it's really important to kind of make sure you know exactly where you fall, what your enrollment periods are, and what you can enroll in and how. The next common enrollment period, these are really for those who miss or did not enroll during their initial enrollment period. So we have the general enrollment period, which is January 1st through March 31st of each year. And that's when you can enroll in regular Medicare or original Medicare. This is a little bit of a, I don't want to say a pain in the butt, but I'll be transparent. It's a little bit of a pain in the butt when you enroll during general enrollment period, because you're enrolling in January and March, but the plan does not become effective until July 1st. So you have quite a large gap of non-coverage there, which is why it's incredibly important to assess your situation or your client's situation when they're turning 65 and make sure that they're electing what they need to elect at that time, so they're not getting any type of penalty or not incurring any type of lapse that may incur when you have to enroll outside of their initial enrollment period. Medicare also has open enrollment similar to regular medical. It runs from October 15th through December 7th each year. And this is really when you get to kind of look into what you're currently on. Part D is probably the biggest part of Medicare that is reviewed during open enrollment, because Part D plans change every year. I'll be going over that a little bit later, but at the end of each year, you will be going over your Part D and also assessing any changes that if you want to move just back to original Medicare, if you're tired of having a supplement, or if you want to move to an advantage plan or vice versa, that is the time of year to get it done, with changes becoming effective January 1st of the next year. And I'm sorry I'm going so fast. There's just a ton of information. So please, if you think that if you want me to re-explain something, just pop it in the chat and I'll make sure that I get to it. So original Medicare, this is Parts A and Part B. These are often referred to as original Medicare. I call it OG Medicare. And this is the parts that are managed by the government. This is the parts that are the fee-for-service plan. When you think of Medicare, this is what you think of. It's a red, white, and blue card. You're assigned a Medicare number. It's essentially, I like to refer to it as the foundation of the plan. We're building a house of coverage here. If we're using that analogy, then Medicare Parts A and B are the foundation of the house. I'm going to go over each part individually. These are going to be kind of basic, so forgive me, but I want to try to get in as much information as I can. Part A covers hospitals. So anything that you can think of for inpatient care. This can include critical access hospitals, rehab facilities, long-term care, even research studies, anything equating to a hospital, even such as like blood draws and stuff like that. That is covered under Part A. Keep in mind, Part A is that part that is zero cost for those who qualify, which I'm going to go over right here. So Part A premiums are 99% of the time, actually, okay, 95% of the time are zero. You qualify due to how much you have worked and paid into taxes in your lifetime. So if you have worked a minimum 10 years or 40 quarters, you will qualify for Part A. There is a current clause in here, and although it is a little bit antiquated, it is still a nice clause in which if you personally have not worked, but your spouse has, you will still qualify. So for example, if you are a housewife, if you are just a homemaker and you've never really actually had a job where you're paying into Social Security, as long as your spouse has, you will still qualify for Medicare. There are those who do not qualify, and if you don't qualify for premium free Medicare Part A, you will have to enroll. There is a premium for that, and it is dictated by the amount of time and hours that you've worked in your lifetime. I'll be very honest, I've only ever had to enroll, I think, one person in Part A on automatically. 95, I'm trying to be trying to be good to myself here, but 95% of the time you are automatically enrolled. I know I worked 10 years by the time I was 20. Oh, okay, maybe not 20, but by the time I was 30, I definitely worked 10 years. So most people have qualified for Medicare way before they were actually Medicare age. As far as deductibles, there is not a calendar deductible for Part A. There is a benefit period deductible. Essentially, that means any time that you are admitted into the hospital, that is when your deductible will apply. Unfortunately, that does mean that you may have multiple benefit periods requiring a deductible, but it does mean that you might not have any at all. It's not like the other types of insurance where you may have some type of deductible you have to meet prior to. This is all per visit, essentially. Right now, the 2022 Part A deductible is $1,556. Seems a little high, but we are looking to see some changes. So crossing our fingers, that's in the direction we want to see down. When it comes to Part A, there are penalties. This is fairly rare because, as I mentioned, the majority of people do qualify for premium-free Part A or automatically enrolled. But if you don't qualify for premium-free and then choose not to enroll, you will be penalized if you enroll later on. For example, if you were eligible for Part A for 2 years, but you did not sign up, the next time you sign up, you will have a higher premium for 4 years. It'll essentially twice the number of years that you didn't sign up. One thing that you will notice is I don't want to say punish, but they definitely lead you into signing up for Medicare when you are supposed to, because there are penalties for those times when you just completely waive it. Basically, regardless of your health status, they want to make sure that you're signed up when you need to be signed up. A lot of people waive it because they're healthy or I don't need Medicare, I feel great. But unfortunately, you'll end up paying a pretty penny for that later on down the road. So we always recommend signing up when you need to. Part B covers physician services. These are doctor services, things that you would typically equate to regular medical care. See provider services, ambulatory services, therapy, x-rays, labs, anything along those lines. Part B does cover to a certain extent. There are gaps there that can be filled with supplemental or advantage plans, as I'll talk about later on. But really, it just covers all of those physician services. Part B does carry a premium. It is a standard premium for most beneficiaries. Right now, it's $170.10 for 2022. There is also a deductible. This one is an annual deductible, so it does run on a calendar year. It's $233 for 2022. On average, it's about 20%, meaning that Medicare pays 80, you pay 20%. That's pretty much average for most services. The only thing when it comes to Part B is that there is what is called the Income-Related Monthly Adjustment Amount, or IRMA. And this can essentially be an added fee addition to that premium if you make over a certain amount. I have a nice little chart here. So for example, if you file jointly and you make less than $182,000 a year, and this goes off of 2020, by the way, for 2022. So for 2023, it would go off of 2021. You would just pay the regular $170.10. But if you, and let's say that you file individually and you're making $400,000 a year, you will pay $544.30 with the IRMA. Essentially, there's no way to avoid this. It all comes down to your income. I will state that even at the highest amount, $578.30, that is, I want to say maybe half of what or more of what you would pay on the regular medical. Right now, regular medical, low tier bronze for someone who's over 65 is upwards of $1,000. So I always try to explain that to my clients that way. Yes, you are kind of being penalized for making a little bit more money, but at the same time, it's way less than what you would be paying on the regular market. So try to look more at the savings than the cost. I know it's hard. There are Part B penalties as well. These are penalties that are probably the most common because a lot of people don't understand that if they don't sign up without any alternative or other coverage, they will face a penalty. I've had clients that go 10 plus years without insurance thinking they're fine. Then when they do want to sign up, they're assessed a very high penalty for the entire time that they are on Medicare. It can add up. We don't want that. Really what it is if you are eligible to sign up for Part B, meaning you turn 65 or you are retiring, if you have no other insurance, you need to sign up for Part B. Otherwise, you will be paying a penalty. Very similar to on the regular medical market, where if you have some type of, if you waive in California, if you waive medical insurance, you will be penalized at the end of the year. Very similar to that here. So Part D, this part is honestly the most complicated part of Medicare because it runs on a drug formulary. So a drug formulary is something that is essentially a list of drugs that are covered by these insurance companies. Medicare is one of the only parts of medical insurance where they break out your prescription coverage from your original Medicare. So for example, if you just have original Medicare, you do not have prescription coverage. You need to add prescription coverage to that. Drug formularies are these very large lists that can vary from carrier to carrier. Something that I always like to tell people is that they do change very frequently. That's why at the end of every year, we go over everybody's Part D, making sure that you're on the same plan. It's not uncommon for someone to move plans from year to year because they're seeing some savings by moving a plan. Part D is hands down the most complicated and the most individualized because it really comes down to what prescriptions you take and how you get those prescriptions, meaning are you getting them mail order or are you having them delivered? Probably one of the most complicated parts of Part D is the donut hole, which I'll go over very quickly. I know we're kind of running out of time, so I'm going to try to rush through this. I apologize. Right now, the average monthly premium is $33 for a drug plan. That being said, the majority of people are on plans that cost anywhere from $7 to $10. There are plans that even cost $150. The average is about $33. More often than not, it's anywhere from like $15 to $33. That's probably closer to average. There is a deductible. The highest that they can charge you is $480 in 2022. But more often than not, there are plans that have $0 deductibles, $150, $250. It's not $480 across the board. It can vary from plan to plan. At the end of the year, Part D will send you, actually at the end of every month, they will send you a overview of all of the drugs that you have purchased, how much they cost, where you're at with your deductible, where you're at in the gap. They're very good about making sure that you as the beneficiary or your clients as a beneficiary understand where exactly they are in this type of coverage because there are tons of weird laws that kind of pertain to it. Drug tiers are exactly like on the regular medical. If you've taken prescriptions before, then you're kind of familiar with this. Tier 1 being the generics and low cost drugs. Tier 2 is brand names. Tier 3 are brand names that are not considered most effective or a little bit more on the brand side of brand names. And then specialty drugs, usually those are, if you have a specialty drug, you know it. They are very expensive and they are very specialized. So here's the donut hole. This is something that is going to change as things change in the industry. We are seeing a ton of stuff coming in with this, but as of right now, this is still standing and this is how it works. This is hands down the most confusing part of Medicare. In a calendar year, you are given essentially this picture is a perfect example. You start with your deductible. Whatever your deductible may be, you are in that coverage until you meet your deductible. Once your deductible is met, you are in what's called initial coverage, and you're only paying copays at that point. On the once you are past that initial point, you enter what's called the gap, and this is where you're going to pay usually the highest amount. You're going to pay a certain percentage based on that type of drug. Once you have hit a certain amount, you will then go into catastrophic coverage. Catastrophic coverage is kind of hard to hit unless you have a ton of prescriptions or very high cost prescriptions. I don't want to say that it's impossible to hit, but it definitely is hard to hit. Once you hit catastrophic, almost 95% of your drug costs are covered, and it starts all over again in the next year. This is a really big reason why it's important to work with your broker at the end of every year and figure out where is there a better plan for me to be on, where I either don't hit the gap or I'm avoiding it. You know, it's something you can definitely work with your broker on and find something that is individually good for you. All right. Part D exclusions. Just like all the other parts of Medicare, there are penalties for waiving. This one is a 1%. There's a caveat on this. If you have employer coverage that does cover prescriptions, you will not pay this penalty. But if you decide to waive Part D, I don't take any prescriptions, well, you still have to get a plan. Unfortunately, that's the truth of the matter. Plus, things can change. You never know what prescriptions might be added on down the road. So it's always good to make sure you are covered and not paying 100% out of pocket for those, or assessing a penalty later on down the line. Supplemental and Advantage plans are two private market options that are very similar but very different. They are private market alternatives to Medicare, but supplemental plans, or Medigap, they fill the gaps that are left from parts A and B, whereas Advantage plans completely take over A and B. So supplemental plans fill in all those extra spaces. Advantage plans basically take over A and B and completely offer you private insurance, usually through an HMO. Supplemental plans are probably the most common because they offer you an option to create full spectrum coverage. Remember when I said we're trying to build a house? So you would start with A and B and then add on a supplemental and anything else you want to add to build yourself a little Medicare house. There's certain plans here in California, A through N. All of the carriers have the same benefits, but their prices may be different. So it is important to shop around and talk to your broker about what benefits you're looking for. Supplemental plans include extra things that Medicare does not cover, including traveling abroad, hearing aids, a lot of stuff along those lines. So it's always a great way to build full spectrum coverage without, limiting yourself with an Advantage plan. So Advantage plans or sometimes Part C are very, very similar to supplemental, except you are replacing your original Medicare. It's very common with HMO. Kaiser is probably one of the more popular ones here in California. I usually don't recommend them unless you are incredibly comfortable with an HMO network or you are looking to save some money, because they are very low cost. If you or a client has some dire small budget, then an Advantage plan is a great option there. Most of these, both Advantage and supplemental plans, have additional benefits. So as I mentioned, hearing aids, some of them even include dental and vision, gym memberships. They're really starting to focus more on not just medical benefits, but things like mental health, smoking cessation, going to the gym, being more active. And so I think we'll probably see a lot more changes in that in the near future. But as of right now, you can still add some awesome additional benefits with a supplemental plan or an Advantage plan. Speaking of the changes that we have coming, I know a lot of you have probably heard some of these, so I'm going to kind of touch on them lightly because unfortunately nothing's really been put into place yet. They've all kind of just teased us with some changes and nothing's really been put in. We are seeing a drop in Part D premiums next year, which is great. This is the first time in a couple years that we've seen any type of decrease. the average will go down to $3,150. Keep in mind that is an average, so it's not there, meaning there's going to be plans that'll probably be under $7 this year, which is amazing. This is the thing you guys have probably heard of the most, the new legislation to allow drug price negotiation. To be incredibly transparent, it wasn't as beautiful sunshine and rainbows as it was portrayed. There's a very limited amount of drugs, only 10 of prescription drugs, only 10 will be able to be brought up for price negotiation, and it will not be able to do so until 2026. Things will increase from there in subsequent years, but as of right now, absolutely no changes in the drug market in that way. There will be some changes, but nothing has been super announced just yet. Telehealth benefits are extended. They were during the public health emergency, or the PHE, they extended telehealth benefits. If you guys haven't used telehealth or aren't familiar with telehealth, I highly recommend looking into it. Essentially, it's just seeing your doctor on a screen, just like we are now, or on your phone. I personally use it all the time. It was great during the pandemic, and now for visits that keep me out of an emergency room I don't need to go to. For Medicare, they did extend it specifically through the end of the public health emergency, and we're hoping to have it move beyond. I have a sneaky feeling that it will be extended indefinitely. COVID-19 coverage is still available for Medicare, including vaccines, tests, and booster shots. This is going through the end of the PHE, but I also still believe that we'll see some type of coverage benefits moving forward, because we all know we're not fully out of the pandemic yet. So we're almost done. I think one of the biggest parts about working in Medicare is just letting you guys know that you need to find the right people. It's very, very complicated. I probably confused the heck out of you in certain spots during this presentation. It's why it's important to work with someone that you like. We as brokers, we are held to very incredibly strict protections to make sure that we're only offering and sending you guys the best for your needs. Specifically when it comes to Medicare, there is a lot of misinformation going around. If you are Medicare age, you understand what I'm talking about. You're seeing a ton of emails, letters in the mail, commercials everywhere. And I'll be honest, a lot of them are giving you wrong information. I yell at my TV all the time. I'm like, no, that's not true. So make sure that if you do get advice from Joe down the street or the guy on TV, that you talk to your broker about it. Because like I mentioned, two people living in the same house might not even be able to be on the same plan. So always take all of your advice with a grain of salt and talk to someone who's certified. You want to be able to like the people who you work with, specifically in Medicare, because you're going to get we're going to become friends, you know? So work with someone you like, and work with someone that you trust, and work with someone that's certified. So this is where I'm going to end it. This is just a little quote that I really like. It is health that is the real wealth, and not pieces of gold and silver. I think the pandemic definitely made us all realize that we need to pay a lot more attention to our health, a lot more attention to our immunocompromised and our elderly. So now's a good time to focus on that. So that's it, guys. I rushed through it. I'm so sorry. I kind of sped through some of it, but Medicare is incredibly complicated. As Heather mentioned, there's a lot of questions we cannot answer due to privacy laws and strict legislations. And since this is just a Medicare 101, kind of wanted to keep it super basic for everybody and not overwhelm you. But you can always reach out to us at any time. Heather or I are more than happy to answer any of your questions, dive deep into a situation or a client problem that you may have. We are literally here to help. On that note, this is our last Lunch and Learn. So thanks to everybody who has come to this one and our other ones. We're not disappearing, we promise, after the series is over. All of our Lunch and Learns are online. You can reach them all and rewatch them all, as well as download any of our one-page summaries or our resources. We have censuses up on there as well. That way you don't have to re-sit through the webinar if you don't want to. We also are offering a one-on-one. Anytime you guys might have something that you really want to learn more about, or you really would like to sit down and have a conversation with someone who knows what they're talking about, we are more than happy to do so. After this presentation, I'll be sending everybody a overview, a one-page summary, as well as a link to our one-on-ones. That way, if you want to learn a little bit more about Medicare, I am more than happy to sit down and completely pick your brain, or have you pick my brain. And same thing with Heather. We know that insurance is incredibly confusing, and it really pays to have someone a friend in the business. So when in doubt, reach out. We are always here to help.
I like that.
And
When in doubt, reach out.
yeah. And really, thank you guys so much for coming. We hope you all enjoyed your lunch. If you did not receive your meal credit, please reach out to me. I'd be more than happy to send it to you. The meal credits last all day, so feel free. If you didn't grab lunch, grab yourself dinner or a snack, coffee later at 3 when you need it. We're more than happy to help and very thankful for everybody for participating.